My name is Candie Gagne, and I'm a proud kidney transplant recipient from Pennsylvania. I'm honored to serve as both a member of the AAKP Board of Directors and an AAKP ambassador. I advocate for kidney patients with a voice shaped by lived experience, clinical expertise, and unwavering compassion. I bring decades of medical service as a retired U.S. Navy hospital corpsman, certified surgical technologist, and an OR educator. I speak the language of patients, physicians, and policymakers alike, bridging gaps with clarity, empathy, and authority. My mission is to empower every kidney patient with the knowledge, confidence, and support they deserve. Advocacy isn't just what I do, it is who I am. It's an honor to be part of the historic milestone as we celebrate the golden anniversary of this event. Our theme, 50 proud years of patient education, 50 years of saving lives, 50 years of saving livelihoods, reflects both the extraordinary progress we've made and the enduring mission that guides us. For 5 decades, AAKP has been committed to empowering patients, supporting innovation, and driving policy change in the kidney care. This meeting is not only a celebration of our past, but also a look forward to the future. We continue to build together one of greater patient choice, stronger communities, and better outcomes for all impacted kidney disease. As a veteran of the United States Navy, I am proud that AAKP launched a special effort in 2017, its Veterans Health Initiative. Veterans and their families face many unique challenges related to managing their health care. And this is especially true for active veterans who suffer kidney disease and other complex chronic diseases. It is estimated that the rate of chronic kidney disease is about 34% higher in veterans compared to the general U.S. population. That's 1 in 6 veterans compared to 1 in 7 Americans. Through AAKP's Veterans Health Initiative, AAKP is committed to making sure our fellow veterans have their voice heard, retain access to care they have earned and are legally entitled to at the VA and elsewhere, and benefit from new research and innovations in biologics, diagnostics, and devices. You may learn more about AAKP's Veterans Health Initiative, the VA research projects this effort is engaged in, and sign up for alerts by visiting the AAKP website. Now I'd like to move to introduce today's important session, Navigating Dual Healthcare Systems, VA and Civilian Kidney Care. Our esteemed speaker joining us is Dr. Michael Wayne Holliday, Jr. Dr. Holliday is a staff nephrologist at the Michael E. DeBakey VA Medical Center and serves as chief of renal clinics, where he focuses on improving access to high-quality kidney care for veterans and strengthening coordination between the VA and community providers. He is also core faculty for the Baylor College of Medicine Nephrology Fellowship and is actively involved in clinical research and developing patient education programs. As we often say in the military, he's the right one for the job. Please join me in welcoming Dr. Holliday as he leads us through our session.
Thank you so much, Candie, for the kind introduction. I interview folks for fellowship in nephrology as a part of our Baylor program, and very often folks will say they have a family member that had kidney disease in the past, or perhaps they themselves had some issue, and that granted them their interest in nephrology. Not just do I love the specialty because of it's sort of how my brain works, but my grandfather had multiple myeloma and developed renal failure from that. And he was on dialysis, then he was on peritoneal dialysis. And I got to see him go through that process. So I think I've had a little bit more exposure to it even before going into medicine. In this talk, I hope to give some practical advice for veterans who attend the VA or attend community care, nephrologist, or seek kidney care in the community through the VA covering that service. So the intersection of this is to give a clear understanding of how the relationship between the VA system and the civilian system works, how we do the authorization for veterans to receive care, how the records move back and forth. In addition, through my experience with working with patients and seeing the issues that they've had, I want to convey some strategies on how veterans can get their goals accomplished if they're having trouble getting in touch with someone, for example. I also want to share some resources that are specific to the VA for patients with kidney disease, and then some words of encouragement at the end. First, I just want to say a few words about where I'm coming from. So the DeBakey VA is in Houston. It's a tertiary referral center for the entire region, and our VA has over 2 million outpatient visits every year. We have a kidney transplant program, liver and heart as well. We do research there, so as she said, I'm involved in clinical research there. And it's a teaching hospital, so we have everybody from physician's assistants to medical students, residents, fellows. So it's a wonderful place to work. And this is in the Texas Medical Center, as you may or may not have heard of, but this is the largest medical center in the world, so it's such a privilege to be there. When taking care of patients with kidney disease, there's a variety of things that nephrologists can help with: chronic kidney disease, acute kidney injury, vasculitis, autoimmune disease, rare kidney disease, electrolyte problems. So there's so many things that we can help with. But the thing that's pressing right now is that population of folks with chronic kidney disease. Worldwide, the prevalence of chronic kidney disease is increasing year by year. And it's especially prevalent in developing countries around the equator. And it just so happens that in those countries, there may not be the best access to renal replacement therapy or to renal care itself. And so this is contributing to increased mortality from kidney disease. Specifically for veterans, if you look at veterans age greater than 65, the majority of them have stageable chronic kidney disease, which is crazy to think about. And then along with that, those with chronic kidney disease have higher prevalence of high blood pressure, diabetes, other cardiovascular disorders. So all of those things contribute to an increased mortality risk. So there's a big difference that we can make in the renal care of the patient, not just of the kidney, but of the, looking at from a holistic perspective at the whole body. I wanted to share some important milestones that the VA has had over the past few years. In the past, and even recently, you may have heard about wait times for veterans at the VA, waiting for an appointment for a specialist or a primary care doctor. So in 2018, the VA Mission Act was passed. What this did was establish something called the Community Care Program. This program will allow veterans to see civilian or outside physicians that are outside the VA, and that could be even for primary care, and it can be for any sort of specialty you can think of. There were specific criteria for the community care program, which I'm going to talk about in a moment. A few years after that, the VA issued Directive 1053, which is the Chronic Kidney Disease Prevention, Early Recognition, and Management Directive. And what this did was basically send down from Washington, D.C. that the VA administrations needed to implement programs and strategies to help with the early detection of chronic kidney disease, develop guidelines for primary care providers and nephrologists to help guide the treatment, the diagnosis of CKD and the treatment of the patients. And then also an initiative to develop educational programs for patients as well with chronic kidney disease. You saw that big portion of veterans that have CKD, maybe half of them actually carry a formal diagnosis. And we saw in earlier talks today that early detection is critical because that's when you can start implementing those important lifestyle changes and medications to help preserve kidney function. So the earlier, the better. And we're, year by year, since I've been working at the VA for 8 years, the volume of consults for folks with newly diagnosed chronic kidney disease increases every year. This year, there was an act passed called the Elizabeth Dole 21st Century Veterans Healthcare and Benefits Improvement Act. What this did was, among other things, further strengthen the community care program. It used to be that when you had an authorization sent from the VA to a civilian kidney doctor, that authorization was good for 6 months. And then it would have to be renewed, which is a process. And so it ended up potentially causing folks to have to wait for that to go through before they could see their kidney specialist. And we know that as chronic kidney disease progresses, you actually need to see your specialist more often. So there was an incentive to strengthen this, and what this act did was actually increase that authorization time to 1 year. In addition, it decreased the turnaround time for approval of the authorization, because it allows the primary care doctor to work with the patient and decide that the patient chooses to go to community care. The PCP can send it to community care directly. They don't have to go through the renal section there. So it saves time and increases the efficiency of the process. But I wanted to talk a little bit more about how the actual consulting process works. Typically, the PCP would be doing your annual labs, and for veterans, they may see on that basic metabolic panel the creatinine number is a little higher, or they may see on the albumin in the urine test that there's more albumin there. And through that directive, guidelines have been issued that the PCPs can follow on when to refer the patients to a nephrologist. When they've reached the conclusion that the patient needs to be seen, they'll go ahead and put that referral through. At the time they put it in, if the patient already knows that they live far enough away from the nearest VA with the kidney specialist, or if they're already seeing a community nephrologist, the PCP can go ahead and send it to community care directly. Otherwise, the referral will come to our nephrology section, and our faculty review that, and then we'll receive it, and then schedulers will call the patient to schedule. Now, this is important. Once the referral has been received by the kidney specialist at the VA, or it's been sent to community care, the schedulers in those various places will try to call the patient to set up the appointment. Our scheduler in the renal department will call the patient multiple times to try to get the veteran on the phone so they can pick a time and date that works for them. If at that time there's a wait time longer than 28 days, the patient can choose to go ahead and be referred to community care for wait time. So this is, the whole community care process is an effort to improve the access of healthcare to the veteran. So if it goes to community care, then the community care office would have to give the veteran a call as well. So one of the important things I wanted to convey here for our veterans is to make sure that your phone number is correct in the VA chart, because that's how you're going to get, they're going to get in touch with you to make your appointments. And I've had a lot of trouble with that with patients in the past. For VA renal care, personally, I believe we do the best job for our veterans. Taking care of veterans is the most fulfilling thing in my life. And I see them over and over. We develop friendships. And what I can do as the kidney specialist at the VA is I'm able to very easily talk with all the other providers that take care of the veteran, their PCP, the endocrine doctor, the vascular surgeon. Everyone is on Teams, and that's not just at our local VA, but the entire country. Even if you come from another state, I can, in just a minute, I can contact the person you were seeing before. So that's one of the great things about the VA, is that the system is so integrated. I take care of ordering those tests for you, interpreting the results. I call my veterans on the phone, let them know about what those results are. We have a new system now where we send letters out to the patient with lab results. I help manage your meds. I help refill and all of that sort of thing. So the difference is, for community care, the PCP plays a larger role in helping assist with ordering of medications and labs. For the eligibility criteria for community care, you see that thing on the top, best medical interest. So that is the criteria that we have now that the PCP can select. And when they're putting in the referral to nephrology, they can put that in and send it directly to community care. So that would be if they already were seeing a kidney specialist, they want to have continuity of care. So we can do that, no problem. Also, veterans are eligible for community care if their drive time is greater than 60 minutes to the place where the kidney specialist is. Keep in mind that some VAs have no kidney specialists in some regions, and so it might be that every patient gets sent out to the community. In Houston, we try to capture as many patients we can. to take care of at the VA, but there's quite a few that live far out from town, or sometimes our wait time is longer, so they end up going to community care for that reason. But the option's there, and I think it's done a great job of improving the access to care for the veterans. I mentioned already that authorization to community care is good for 1 year now, and then this is important, at the community care nephrologist that you're seeing, the notes that they generate when you see them, the plan of care and everything, this will be sent to the VA for your primary care doctor to review. Requests for new medications to be ordered, and potentially lab tests or radiology that you might need, you can choose to have that done at the VA as well, and so the PCP would help mediate ordering those things for your community care nephrologist provider. The authorization also covers the community care nephrologist for doing their own labs in their office, in addition to kidney biopsy and treatment, all related to the kidney disease. So all of the relevant things are included in the authorization. It's just some veterans prefer to do labs at the VA or to have imaging tests at the VA. But it does require communication between that community provider and the PCP at the VA. The community care office is the mediator between these two entities and also with the renal section. Whenever these renewal for services come in, we actually get a notification, and we can review what that community care nephrologist is doing to make sure it's appropriate, and then we would go ahead and renew the consult. We're also there to assist with ordering medications and any other issues the patient might have. The thing with if any veterans have any issues with trying to get their appointment with the community care provider, whether it's renal or any specialty, the thing to do is to call your local VA and ask for the operator, and then just ask for the community care office, because these are the folks that know all about, they would be able to see your authorization, and they help match you up with a provider in the community that you're seeking and help you with scheduling. So I already mentioned this. So I wanted to now go through some practical strategies that I have found have been very helpful for patients in general at the VA in obtaining their care and streamlining the process. The first thing is My Healthy Vet. So My Healthy Vet is an online platform offered by the VA. It is available nationwide. And what this allows is you log into it, you can see all your medications, request renewals or refills, you can see your appointment list, you can see health records, and in addition, you can send messages. The messages you can send to your primary care doctor or any of the specialists that you see. This is a great way, if it's a non-urgent issue, to ask questions of your provider and get a response directly back from them. Our faculty are expected to answer these within one to 2 days, so you should have a quick turnaround time. And then if for some reason the message is sitting longer than that, it gets escalated, so these typically are answered very well, and we have very good compliance. This is a great way to keep your providers updated on how your blood pressure is, and if you're having any issues with the medications or if you need refills, you can use this messaging option. I did want to say that if you have issues with My Healthy Vet where you can't actually send a message to someone, your local VA will have a My Healthy Vet office with someone that actually works there who can help fix the problem for you. Next, I wanted to share that the VA offers something called Health Connect. This is also, if you call your local VA, you'll hear a prompt, and one of the numbers says the 24-hour nurse triage line. If you're trying to get in touch with someone, and let's say you don't really have a computer, so you can't use My Healthy Vet, which a lot of veterans do not, you can actually call on the phone and talk to a nurse any time of the day. This would be for non-urgent issues. That nurse would then take your request and put it in a note in the chart and assign it to the person you're trying to get in touch with, and that would go in their in basket. So this is a sure way of being able to get in touch with someone at the VA. I'm sharing this because sometimes patients have issues with calling and trying to get someone particular on the phone. I don't know if you've ever had to wait on the phone. But this is a great way of accomplishing that, where you actually get to talk to a person and then they will send a message to the right person to help address your concern. So, and these QR codes just take you to that specific website. Each VA region, it might be a little bit different in how it's implemented, but they all have this 24-hour nurse triage line. And in fact, you can actually make an appointment with a medical provider via a virtual visit through this platform as well. The last line, if let's say a veteran's trying to get in touch with someone and they don't have My Healthy Vet, and then they called and left a message with the nurse, and then no one's really calling them back, I think that would very rarely happen. But if there's some issue where you're trying to get answers or having some sort of trouble, every VA has the patient advocate office. And these people are amazing folks that help to sort of cut through the red tape and figure out what's going on and sort everything out. And so this would be another way that you could, if you're having a pressing issue, get that addressed. And even if it's with, if a veteran has concerns with a community care provider, the patient, or if they're on dialysis that's authorized through the VA, the patient advocate's office is there to help veterans address their concerns. Lastly, I wanted to share the medical records office. So you do have access to some records on My Healthy Vet. However, to get actual copies of your records, you can actually submit a request online, by phone, or going in person. Each VA location will have a little medical records office window. So there are some specific resources at the VA for folks with chronic kidney disease. There's some that exist now, and then there's some in the pipeline. And each region, each VA has a little bit different set of resources, but I'm sharing what we offer from Houston. The eKidney Health Clinic is actually sort of national. It's on the National VA website. And this is the QR code to get there on your phone. This will have information on dialysis modalities, nutrition, healthy eating, social work services, pharmacy issues, and treatment options. So it's just general information that is helpful. Now, there actually has been an ongoing study called Teach Vet out of Florida looking at specifically designed training for veterans to learn about the different types of dialysis and home modalities. And so after, at some point, we're hoping to roll that out in Houston too. The renal dietitian services I have found to be absolutely amazing. So my renal dietitian's name is Holliday. They're in Houston, so she will see veterans in face-to-face visits, video, telephone, and also in group education situations. And then not just for chronic kidney disease diet, but also for folks with gout or kidney stones. So it's a very helpful resource in terms of being able to learn how to eat to improve your health. And then also, widespread at the VA is something called the MOVE program. The MOVE program is it's a program that veterans can enroll in to help with weight loss. They go through diet and exercise, and they also provide coaching. And this is a very important, I've actually had quite a bit of success with my veterans for weight loss using this program. And by the way, weight loss medications that are kind of a hot topic right now, you have to be participating, even outside the VA and any insurance, you have to be participating in a weight management intervention to be able to have those sort of medicines approved. But I've found that this is very helpful for veterans. So each VA will have sort of a different iteration of this MOVE weight loss program as well. So I just wanted to share that with you. Lastly, I wanted to share about traveling veteran services. Now, when it comes to veterans qualifying for a travel benefit or qualifying for caregiver support or different things like that, it all has to do with the veteran eligibility, which the veterans probably know more about than I do. But for certain veterans, travel veteran services can be very helpful. For example, for kidney transplant, let's say a patient lives in a different part of the state and they got an organ offer, the VA will fly them in and book them in a hotel and everything. So for our local veterans on hemodialysis, some of them qualify for Uber benefit to have them bring them back and forth to dialysis. So there's a lot of potential options there depending on the veteran's eligibility, and the Travel Veterans Office is there to help with that. In addition, there is a foreign medical program service, so for any veterans that have to work overseas, you can actually apply for that program on the website, and it will help you obtain medical care in a foreign country. And then lastly, we have the ability at the VA to do something called interfacility consults, where if I have a patient here in Houston, let's say, and then they're going to be traveling to another state for several months for work, I can actually order tests and imaging. I can order referrals for them to see in that state at the local VA in that state, and that's called an interfacility consult. Let's say they did labs in another state, those results would be sent to my in-basket here in Houston. So I could still help take care of the patient even though they're out of state. So there's a lot of flexibility with how the VA is made. And even though there's certain things to be said about the VA electronic medical record, the data is there for the entire country. It is absolutely amazing. So I really appreciate that, and all of these services that are available to help veterans with managing their kidney disease. There's so many people involved in helping patients with kidney disease, not just with what medicines we're going to be on, but a big part of it is the lifestyle, the diet, following the blood pressure, compliance with medications, the counseling about the types of dialysis modalities. And we saw earlier about that patient-centered approach, which I really appreciate. And we're hoping, as I said, to develop and roll out some, at our local VA, some programs where it would be sort of a group education effort where veterans will be able to learn about the different types of dialysis. At present, I do that one-on-one with the patients in clinic. So, for Encourage, whether a veteran is going to the VA or a community care provider, I would recommend, some veterans might need to have their family with them for these sort of encounters where we're talking about the choice of dialysis modality. But keep in mind, I think what would be very useful would be the tool that the AAKP is going to be releasing on the patient preferences, highlighting what their goals are for how they want their life to look like. Do they want to be able to work, do this or that, and how that fits within what you would be able to do for renal replacement therapy. I think it's important for patients and families to be able to contact a provider and receive a response back in a timely fashion. And I think all patients should be notified of their results, and if anything should be modified with their medications or anything based on those results. Any patient should have that. And I would say I would want to encourage patients and their families to establish that with the provider that you're seeing, that you understand that they would be doing that, and set expectations appropriately, okay? So thank you so much for your time, and let me share about our VA in Houston. I'll let you get back up here.
Thank you, Dr. Holliday, for sharing your expertise and passion with us. And most importantly, thank you for choosing to focus your career caring for the great men and women of the service who have served our country. And to support Dr. Holliday's presentation, I'd like to share a little bit about my experience as a kidney patient and former care partner of a kidney patient who received care through the VA. I and my husband, who passed away, and he was in the memorial slideshow earlier, he passed away from kidney disease and congestive heart failure, and he was 100% disabled veteran. So he was already in the system and so on, but because the specialty time was so long for him, he was sent out to community care, and he actually received all his care at the same treatment facility I did. Now, the other caveat to that is because we were both retired military members, we also have TRICARE. So that sort of gives us another option to go out and seek treatment in the system, and that way give more people the benefit to use the VA for those that don't have those options. I do have a lot of experience with the VA. My dad was a VA patient, and he had his PCP there. He had cancer surgery there. He was well taken care of, and I really appreciate everything that they did for him. At the VA Medical Center in Pittsburgh, we have some wonderful people that work there, and they have even started like a PCP clinic in the kidney clinic. So the PCPs for the kidney patients are right there in the clinic with them. We're actually working on some initiatives to do some more education and those kind of things through the Veterans Health Initiative. And I've been able to actually set on some focus groups with some veteran dialysis patients that have both been in community care and in VA treatment facilities for their dialysis to see how that we could better serve them and take their needs up to our elected officials. So that's about what my access is, but we have some time left over for questions. If anybody in the audience would like to have has a question, please raise your hand, and an AAKP team member will bring the mic over to you to get us started. And I'd like to, anybody up there? Okay.
Dr. Holliday, is it on? Can you hear me? Yeah. You talked about that the VA members can seek community care if they can't be seen at the VA within, did you say 29 days, 28 days? I'm wondering, what do you think the average time it is to see someone in community care?
That's a great question, and it depends on where they're actually located. So we can pull that data, but even in certain areas with community care, the wait time sometimes is a little longer too. So then they might come back to us, and then we have to look at it again. So,
Candie?
Okay.
Sorry, I'm not standing up. Do you foresee some cutback in the budget for VA? My husband is disabled, and I know there's lots of cuts. Has anything come down to you?
no. So we have actually, I just onboarded a new colleague a few weeks ago, and then we have another transplant kidney specialist that's been hired as well. So I have not seen any sort of cutback.
I didn't realize this is an active duty nurse practitioner, but I wanted to let people know that Walter Reed does have a kidney transplant center similar to what the VA offers in terms of travel and staying there after your transplant. And I can't tell you how many other vets I've talked to and they weren't aware of it at all. But they do just kidneys and they cover the whole thing. There was one place I got listed, that's not where I got my kidney from, but the whole 9 yards, everything's covered, the transportation and everything.
Well, I have a couple questions, Dr. Holliday. Sometimes patients feel feel like they have to repeat the same information over and over when moving between VA and civilian providers. Are there tools or strategies you recommend to improve that communication?
Yes. So presumably they would be giving the first, they're giving the story the first time at the VA. So if they are then referred to a provider in the community, the VA actually sends all the records. So if it's documented of what they were saying, then the provider should review that before talking to them. Now, whether they do or not
Is another story.
That's another story.
How do patients decide between VA-operated dialysis versus community dialysis?
That's a great question. It also depends on their location. So in Houston, we do not do outpatient dialysis unless someone's coming in for an appointment. We do them in the hospital unit. All of the patients on community care dialysis in the community. But in some places, the VA would have an outpatient unit.
Right.
So it just depends.
Right. And lastly, if a veteran pursues transplant evaluation at a civilian center, how did VA and the transplant team share information and align coverage before and after the surgery?
So the transplant team has, if they're transplanted at the non-VA place, I think the access to the records is most likely provided on, we have something at the VA called the Joint Legacy Viewer, and in that there is actually an application that displays records from all kinds of other hospitals. So when I've taken care of patients that have been transplanted at other places, I can see, most of the time I can see all of their information.
And that's one of the big benefits about the VA in military medicine now, is we're finally talking to one another and we're talking to outside hospitals. And that's one of the big pluses for the community at whole because we have that benchmark set. So, thank you, Dr. Holliday, for sharing your expertise and passion with us.